Alright, welcome back. So in this video we're gonna speak a little bit about the normal physiology of electrical impulses in the heart, right? And this is not going to be an exhaustive discussion about it. It's just going to be like the basics, just enough to interpret the ECG. So okay, let's just draw a heart. Great. And the heart, as we know, well, let me not say as we know, the heart has 4 chambers, right? Cool. All right. And so this is the left, this is the right, and we're imagining, you know, this is inside a patient's chest. All right, so that's for some orientation. And inside the heart now, in terms of the structure, the relevant structures which we will be discussing, you have the SA node, which is in the right atrium. All right, then you have the AV node, which is at the junction between the right atrium and left atrium. So it's between the junction of the atria. Let me put an A here. So it's at the junction between the atria and the ventricles, right? And then in the ventricular septum, you have something called the His bundle, which divides into the left and the right bundle branches, which then form Purkinje fibers, which distribute conduction throughout the ventricular myocytes. All right, so that was a mouthful, right? So let's just write it out in step format, just to summarize what I just said. So step 1, SA node fires. 2, conduction through both atria. All right. 3, right, impulses what's the word I want to use? So impulses are slowed at the AV node. 4, impulses conduct down His bundle into bundle branches. 5, impulses conduct through the Purkinje to ventricular myocytes. Okay, so that is the normal pathway of conduction, right? What I want to highlight is, as we mentioned before, the electrodes, they pick up mean electrical vectors of tissues, not individual cells. So I think this is kind of a point of confusion, and not just any tissue. It has to be sizable tissue, right? So for example, on the ECG, we don't see the SA node, which is this, firing. We don't see it as an impulse. What we see is the depolarization of the entire atrium reflected as an impulse, right? we don't see depolarization of the His or the bundle branches individually as an impulse, but you can see evidence of depolarization of the septum or of the ventricles as an impulse, right? So that's an important point. So a lot of these individual structures are too small to be reflected on the electrode, the surface electrodes, right, which are the electrodes that are on our skin, right? What we really see on the ECG is the mean electrical vector of the depolarization of large areas of cardiac tissue, right? And okay, so that's one major concept. Let me see. Okay, so at this point, I think it's reasonably relevant that I just briefly talk about the types of cardiac tissue. All right, you know, there's a lot of things we could talk about, and I don't want to just go on and on forever without ever showing you an actual ECG. But essentially, you have three types of cardiac cells or myocytes, right? You have, well, at least when it comes to electrophysiology, right? You have what are they called again? Basically, cells that have automaticity, right? Okay, I remember the name now. So pacemakers, right? Then you have cells that conduct well. So let's just call them conductors. And then you have cells that contract well. All right, let's call them contractors, right? So what we're saying is any cardiac cell, so let's draw a little heart with a little nucleus, right? A little. So we're saying this is we're imagining that our heart is made of little heart cells that look like this, you know, with a little heart membrane. So anyway, what we're saying is you have some heart cells that they are able to depolarize spontaneously, right? So they, in a regular fashion, depolarize and repolarize, and they basically set the pace for cardiac electrical activity and contraction. So those pacemaker cells are what is basically found in the SA node that we mentioned already, right? So these pacemaker cells, when they depolarize at regular intervals, they activate or they set off the wave of electrical activity in the atrium that thereafter goes to the AV node, is held there briefly, and then spreads to the ventricles, right? That's the pacemaker cells. Now you have specialized conducting cells, right, that allow these impulses to propagate or pass on rapidly. You have specialized conducting cells in the atria, which we're not going to get into too much what their name is, but you have specialized cells that create highways, if you want to describe it like that, in the atria, right, that allow the impulses to conduct rapidly. And then the bundle branches and Purkinje system, which we mentioned earlier, are also specialized conducting cells that allow impulses to travel very rapidly, right? And then the rest of the cells that are in the heart are basically contractile tissue, right? So when they are stimulated, yes, they also propagate impulses, but they also, more predominantly, they are specialized and differentiated to be able to contract well. So what is the take-home message? Well, the interesting thing is, even though you have specialized automaticity cells, so let's draw, so this cell is like a clock, and you have specialized conductor cells, so let's say this cell is like, I don't know, a battery. Then let's draw this cell like a battery. So it's got a positive and a negative. And you have specialized contractor cells. So contract, what could that be? Okay, this cell looks like a literal contract. All right. So these are our three cells, right? What we're saying is that the pacemaker cells, they still have some ability to contract and some ability to conduct, but they pace best, right? They are the best at pacing. And then the conductor cells, they have some ability to contract and some ability to pace, but they conduct the best, right? And then the contractile cells, they have some ability to conduct and some ability to pace, but they contract best. So for example, what happens is if your pacemaker fails, right, one of these can actually, a cell in one of these lineages can actually become the pacemaker, right? It's just that these cells tend to pace more slowly than the intrinsic pacemaker cells, right? And also, all of these cells contract. However, it's the majority of the cardiac myocytes that are involved in actually moving blood throughout the heart. Those are specialized for contraction. So the conductor tissue and the pacemaker tissue doesn't play a big role in that, right? And all of the cells, right, they're able to conduct, but the specialized cells conduct more rapidly so that it doesn't take forever for an impulse from the SA node to conduct throughout the heart. Like it happens in a rapid fashion and in a very organized fashion. And this understanding is going to be important coming up later on.